Well, thanks everybody so much for coming today. We really do appreciate the opportunity to just have a moment and talk through some of the research that's coming out of Rocky Mountain and really have an opportunity to ask some questions. I mean, what we've noticed here is that so many people nationally and internationally have come to Denver for psychedelic science here in 2025, and that's actually what our most recent study is really documenting this travel pattern. We are really excited to do this. And what we're going to show here is that actually a third of people that have used a psychedelic substance in the last year have actually traveled specifically to do so. And so I think that reflects very much what's happening here at this conference. And it is well timed with some of our Department of Regulatory and our state colleagues just getting ready to kick off the Healing Center programs here in Colorado. So what we're going to do is share findings from the largest and the most rigorous study on real-world use of psychedelics ever really done, the National Survey Investigating Hallucinogenic Trends, or NSIGHT. So this study we've been working on for 3+ years, and we've already enrolled over 4,000 people. We're already starting to actually analyze 2025 data, so it's timely. And really what we do is we enroll patients over 18 years of age that have utilized a psychedelic substance in the last year. It's nationally representative. We actually have respondents from every U.S. state in Washington, D.C. We put a ton of work into the rigor of the study through test and retest, as well as reliability, focus groups to understand and make sure that we're asking the right things. And so we're excited to present the first findings from this that will be published in the Annals of Emergency Medicine. So what this study shows, as I mentioned, is that a third of people that have utilized psychedelic substances in the last year have actually traveled specifically to do so. This affects people in Colorado, and in fact, actually 42.9% of the people that have traveled actually have come to Colorado. 29.8 of them have actually have gone to Oregon, and 38.5 have actually traveled internationally. So that's a large number of people. As we sort of think about that, that's 5.1 million people traveling actually every year, specifically to use psychedelics. As I said, these people come from all over the country. And so you may ask, what are the characteristics of these people that are traveling? Well, they're actually more experienced with psychedelic use. So these people have used multiple psychedelics. They're more likely to use to treat medical symptoms. 23.4% of travelers compared to 17.5% of non-travelers used to treat a medical symptom. However, recreational use is still the most common reason why people use for fun and enjoyment, and that's 32.8% of people that have utilized. So, what we know is that travelers are more likely to use in healing centers and or in ceremonial events, which is actually a nice positive thing we would suggest. And actually here in the state, as we kick these things off, we're likely to see those numbers rise. That was actually 43% of travelers actually use the healing center or a ceremonial setting to utilize these substances. And finally, I think that we've heard so much of the science around treating mental health conditions. We know that travelers are much more likely to have a diagnosis of a mental health condition. Actually, 73.4% of travelers compared to non-travelers actually have a medical diagnosis. 51.7% of non-travelers and 73% of travelers actually have a mental health diagnosis. Depression really drives that, but really it's multiple different mental health conditions. So, we are seeing through our data and this NSIGHT tool that psychedelic drug use is increasing every year. Psilocybin is really driving that, and that's what you're seeing here in Colorado. But we're going to continue to see this happen. And so what we want to do is make sure to let people know that they can and should be talking to their physicians about this, because they want to know whether or not this is safe for them and whether or not it's the right drug. We at Rocky Mountain will continue to collect these data, and we're going to do this several times per year and make sure to actually get these data out so that people can be advised about where the safety is and what mental health conditions actually may be effectively treated. We think that there are going to be benefits, but there may be public health risks as well, and so we hope to be able to communicate that going forward. This is a really wonderful team, and so I must thank the team at Rocky Mountain who've just done wonderful work putting this together. I mean, this is a team of incredible scientists. I mean, we have a team of almost 40 in research running this study. And so it's just wonderful, the work that they put in. So thank you very much, and I'm happy to take any questions about the findings that will be published here this month.
Is it Dr. Rockhill?
I'm Dr. Monty, actually. Dr. Rockhill is one of our lead scientists on this study.
Yeah, gotcha. So, Dr. Monty, is there a universal group? I guess I'm a little confused how you get to a class of people and then you divide them up. You have 21 and 24 respondents. Did you track their childhood first or their orientation to psych?
Yeah, it's a great question. So essentially what you're asking is how we actually get the respondents. Yeah, so what we do is we actually utilize a very large survey panel company. So when you get calls about like political surveys and those types of things, in general, these panel companies maintain very large groups of people across the entire country. So these are, a couple of million people in these panels. And so what we do is we ask them whether or not they've utilized a psychedelic substance in the last year. And if they meet our inclusion criteria, then we ask them the full breadth of our survey. So these people actually also fill out surveys on, commercial items, over-the-counter medications, on multiple different things. And so what that does is it allows us to actually understand what's happening in the entire population, not just in a focus group like on some forum where they're always talking about psychedelics, right? So this is what's happening in the real world.
So you have a third of that. I guess we're back to this, and at this conference and at all the conferences we have, the underground, we have the regulated.
Yes.
So at this point, the regulated is just kicking off in Colorado. And what your survey seems to indicate is that respondents are coming to Colorado and finding psychedelics in the non-regulated area.
That's correct.
And did you have a problem with people revealing that? It's a constant with people knowing Schedule 1 who want to know the research.
It's a great question, and the short answer is no. And the reason for that is because we take great pains to make sure to maintain the anonymity of people that respond to our surveys. We have been running these types of surveys for decades where we talk about different substance use, opioids, fentanyl, many other sort of hidden behaviors, as we like to say. This is something that we take a lot of pride in, and we actually have obtained certificates from the federal government of confidentiality. We actually don't even ask people's names. What we do is we put a lot of work into making sure that the answers we get are good answers, and we do some test and retest things to make sure that the answers we get are the true answers. Most other surveys don't do that type of work, all that extra work to actually do focus work and focus groups and test, retest, check the validity of the questions, monitor things over time, repeat these things. And that's one of the things I'm most proud of our team in being able to do, is really the rigor of those findings. Yes, absolutely.
Interrupting on to you, but I'm just curious, in the data, were you able to discern what parts of the country people are traveling from to access legal?
We are, and as a matter of fact, so not surprisingly, our surrounding states are certainly traveling more to Colorado. We know that our surrounding states and from New England come more to Colorado. The surrounding states around Oregon go there. However, we're seeing travel from every U.S. state, and so that's an important thing. This is a nationwide phenomenon, and we're going to see more and more of this, right? As people come and seek the healing centers here in Colorado, we're going to see more and more travel here. So there are some benefits there, right? In that this program is affecting people outside of Colorado. That's an opportunity for us to treat more people potentially, but it also does represent some risk, right? Because we need to make sure that people have those resources for when they get home, and we need to talk to our own physicians here as well, so that if somebody comes up in an emergency department, to make sure to talk about this so that people are put in a safe place. there's a real potential to increase the impact of what we're doing here in Colorado, but we actually have to make sure to communicate back to the patients about having the support afterward.
There's always a poison control aspect. So CDPHE is going to start collecting all experiences. But at this point, if I comment about the general Colorado hospitals responding to folks, tourists and non-tourists coming into their hospitals in an ER situation?
Yeah. Of course, it's a great question, and the short answer is that we actually don't have a great way to monitor what's happening in the hospital, and that's because we don't. Typically, the way we track people coming into the hospital are through these things called international disease codes, and there aren't good international disease codes for psilocybin use, for instance. We looked at this actually, and when we looked at 5 years of data across the entire country in a national data set, we actually only found 2 cases of psilocybin, which just demonstrates that it's just not an effective tool, which is why you need a tool like Insight actually, because then you can ask, hey, have you been to an emergency department? So you get everybody, not just actually the people that are coming to one specific hospital. I can guarantee you, as people start to actually look for these things, you're going to see the rates of emergency department visits go up. But that's not necessarily because those visits aren't there right now. It's just because people are going to start to document it, and you're going to start to see those codes be utilized. And so you will see rises, and it's going to cause a lot of media attention. But I would suggest to you some of that stuff is already happening. Our physicians may not be asking about it yet, so that's one of my recommendations. But secondarily, I think that as we think about and we ask about it more, you're going to see those codes go up.
So the codes do exist now?
There are general codes. There are general codes for intoxication. And so what would happen is somebody would take the intoxication codes and then try and pull these things out. Most physicians aren't documenting right now that, hey, this visit was due to somebody using psilocybin, for instance, right? We do capture that stuff through the Poison Center, but that's only a small number of cases as well. In those cases, don't necessarily capture the detail of the visit that you might want to know. Where did people get it? Whether or not it was used in a state, in the state program or outside the state program, right? What we have seen initially from our review of those cases is that the use actually, and where people get into trouble is when things are used in an unsupervised environment. We're excited about what's happening here at Psychedelic Science, and I mean, I would say that our state is trying to be a leader in this and do this in a safe way, and our government colleagues have been wonderful about setting up wonderful programs in order to do this. The next phase is going to be watching and seeing what happens, because the effect on public health is still unknown. And so that's where we're tasked now, is to look at what the outcomes are of patients that are using. We may see major benefits in mental health conditions, but we are also inevitably going to find some risk. And so what we want to try and do is identify that risk and then minimize that preventable harm.
Pretty important with these of the psychedelic, I like to call it the academic stuff. I mean, they've got NYU, Yale, Johns Hopkins, UC, Berkeley. Any of those involved with the program?
So this study is a Rocky Mountain program. We are actually utilizing them as advisors on our program, and so we do collaborate. I work very closely with the group at OHSU, and we've sort of worked through this stuff. This study is funded by the Substance Abuse and Mental Health Services Administration, SAMHSA, and because you can imagine they're very interested in the effects on mental health, right? And the potential effects on people that are utilizing these substances for substance use. So this was funded by them. We have utilized that 7 group just as consultants, but really actually this is Rocky Mountain's specialty. We've been doing this work longer and better than anyone.
Documented?
Yes.
I'm the topic. So you have observed how state agencies have coordinated in both cannabis space and also as agencies that work together to roll out this natural medicine program. From your observations, is there anything that stands out as far as what's the most critical in ensuring an effective, framework is set?
Yeah, it's a great question. I think that the most critical thing is involving stakeholders, and I think that our state has done a really good job at really involving stakeholders across the state. I think that has been really important. Lots and lots of dialogue, and interagency dialogue, which I'm starting to see more and more of. I think that you've always done it, but I'm seeing more and more of that as this is getting ready to really roll out. That's going to be critical as you move forward, because what I think is going to happen is there's going to be data in multiple places, right? And you want to be able to actually put this all together to be able to tell the true story of what's happening across the state. And outside the state, as we're demonstrating here, right? This is about travel to the state. So what are the effects of people that are traveling here? You're going to want to know that. You're going to want to know what's happening in people in the program versus outside the program so that we can actually drive people towards safe use. I think that there's still some questions around how the data will, be utilized, and so that's. I hope those conversations do continue as we're starting to administer the first few, treatments here in the state. Because I think that again, we already know that people are utilizing for medical reasons as well as non-medical reasons across the state, and so we really need to start to actually think about how the state is going to get those data and utilize them and make them available to the public. Well, thank you so much all for coming. If there's anything else, please let me know. I'm available by email as well. We're always happy to share the data as they come out, and we really appreciate all the support today. Enjoy the conference.